So much. Fantastic. Alexa, could you pull up my slides, please?
Yes, 1 second.
Thank you. And while she does that, I'd like to welcome everyone to today's Foundations of Global Health series. We have a wonderful guest with us. And we also have Mindy with us today, our sign language interpreter. Please look in the chat box if you would like to see how you could pin her video. Thank you, Alexa. Fantastic. Okay, next slide, please. Thank you. All right. Again, welcome everyone to today's Foundations of Global Health series. Our learning objectives, the learner will gain foundational information on pathways into global health and will be challenged to deepen knowledge on equality and mutualism, which garners true collaboration and global health exchange for everyone's equal benefit. Through this series, the learner will also examine existing attitudes around global health so that we at the University of Kansas Medical Center are trendsetters who move beyond the us versus them and have versus have nots mentality. The learner will be able to appraise global health, including global health research, philosophy, approaches, attitudes, and the varied efforts in the areas of health disparities, health inequities, health inequalities, and community health. Our upcoming events in this series include today's presentation by Dr. Halsey. He will give us an insider secret to starting a career in global health. We have Dr. Misha Lawson, who will join us on February 22nd at 1 p.m. With a presentation on adaptability for maximizing global experiences and impacts. Dr. Malfatti will join us on March 10th at 12 p.m. With a presentation on cross-cultural relations. And lastly, we have Dr. Mani. That presentation will be on Thursday, April 1st at 12 p.m. And he will speak to global health to serve or to learn. And as already mentioned, today we have with us Dr. Eric Halsey. After graduating KUMC in 1999 with a medical degree, Dr. Eric Halsey has embarked on a multifaceted career in global health that has, at different times, focused on medical missions, health worker training, research, surveillance, outbreak response, and program implementation. He has worked for the U.S. Air Force, U.S. Public Health Service, and Centers for Disease Control and Prevention, concentrating on infectious diseases impacting South America and Africa. Dr. Halsey was honored in 2017 as our Early Career Achievement in Medicine alumnus. As a captain in the U.S. Public Health Service, Dr. Halsey currently leads an anti-malarial resistance surveillance program in Africa for the US President's Malaria Initiative, while being based out of the Division of Parasitic Diseases and Malaria at the Centers for Disease Control and Prevention in Atlanta. Without further ado, please welcome Dr. Eric Halsey.
So thank you, Christine. And maybe there's a little bit more ado as I try to figure out if I can actually share my screen. So give me 30 seconds and let's see if I can do it.
Absolutely.
And if not, I'm not going to make you endure any more pain. And we'll just turn it over to you sharing the screen.
Take your time. Thank you so much for being with us today. We are very excited to have you.
Oh, it's my pleasure. You know, I'm only sad that we're following the Super Bowl. I'm still a Kansas City Chiefs fan.
Yes.
And so kind of a day of mourning a little bit.
It really is.
Let's not talk about it.
Okay, so hopefully my whole screen is showing now as it should have. Does this work? Okay, yeah. Well, perfect. So I'm really, really excited to give this presentation. As Christine said, I am a graduate of KU Med Center. I also grew up in Kansas. I went kindergarten through 12th grade in Shawnee Mission North, as well as the Shawnee Mission East school districts. So I'm very much a Kansan still at heart when people ask me where I'm from. Although I've lived in like 8 states, Kansas is always what I say. Yeah, maybe sometimes Georgia, because that's where I am now. But really, Kansas is in my heart. I'm not going to give a whole lot about what I do. I think Christine touched upon it a little bit, so I'm not going to make you endure a lot of slides on that. But just to give you some feel for my background, I think the first 4 or 5 slides will be on that. And as Christine mentioned, I do work for the U.S. President's Malaria Initiative. And if any of you are familiar with PEPFAR, which is the program that Dr. Birx used to oversee, PEPFAR is for HIV, and PMI is kind of the equivalent on the malaria side. And so it was instituted during the second George Bush administration. He's the president of the P. But then it moved on through Barack Obama and then Donald Trump, and now it exists under the Biden administration. So we're very proud that it's lived this many years. What I do for it is kind of a mix of programmatic activities as well as research. And then I also still practice as an infectious diseases physician, as well as an internist. And we'll talk a little bit about that. And then occasionally I do get deployed, and that really is where a lot of the global part comes into what I do. So just to kind of hit the different aspects of what I do from day to day. So programmatic, which probably wouldn't have meant a whole lot to me 10 years ago. But programmatic is essentially making sure that the money gets spent that we provide to Africa. And as it says here, PMI, the President's Malaria Initiative, is a $729 million budget compared with PEPFAR, which is about $8 billion. So the US does a lot of good work overseas. We don't always get credit for that, but PMI is one of those places where we do a lot of good work overseas. So PMI is predominantly Africa. We work in 24 different countries in Africa. I work in many of those doing what I do. So it's been very interesting learning all about the continent, the challenges, and also the success stories. I am the lead on a case management team for PMI, for the President's Malaria Initiative. And case management is essentially the diagnosis and treatment of malaria. So a lot of what PMI does has to do with diagnosis and treatment. So I get to lead that aspect of a very large portfolio. It's very gratifying. In addition to that, I do lots of research and surveillance. I'm the lead for all of PMI for looking for anti-malarial resistance. And this is just a map of Africa and all the countries where I work. On any given day, I'm sending emails to 10 of these countries, usually African leaders in their field, malaria lab directors, talking about resistance and the best way to monitor for that in their countries. Sometimes I travel to the country and help with efficacy studies. So also very gratifying. In addition to looking for anti-malarial resistance, we also surveil for a mutation that really makes our rapid diagnostic testing ineffective or less effective. So these are really 2 of our big ways of intervening. 2 of our big interventions are rapid diagnostic tests and anti-malarials. And unfortunately, they're both threatened in Africa, as well as in Asia and South America too. So a big part of my job is just tracking that and making sure it doesn't get out of control in Africa. And then in addition to all of that, I have a side hustle. I still want to be a physician. I went to med school for 4 years, and I went to residency for 3 and fellowship for 2. And I even worked as an infectious diseases doctor for 5. So none of what I've talked about preceding this has anything to do with clinical medicine, but I still very much keep my hand in that. And we have a VA here in Atlanta where I do volunteer, and I work for an HIV clinic twice a month. In addition, I'm on the famous malaria pager. So if you ever get a malaria case in your emergency room or on your wards, chances are the doctor's never seen a case of malaria. And printed in almost every textbook is a phone number of how to get a hold of the CDC for malaria questions. So I'm one of about 10 doctors at the CDC who takes those questions. In fact, I was on call last week. And that's very interesting. I didn't get any calls from Kansas last week, but I definitely have gotten calls from Kansas in the past. So in addition to all of those slides that I just presented, there is an occasional deployment that really spices up my professional life. Here are 3 that I've done recently with the CDC, including in 2015. I joined the CDC in 2014, and a few months later, I find myself in Sierra Leone, part of the vaccine trial. And here's one of the Ebola treatment centers where I worked. Some are a little bit less flashy. I worked along the border. This was in 2019. This is the Arizona-Mexico border. And you may have heard of immigrant children not being taken care of well or not receiving medical care. In fact, 2 died a couple months before I went down to the border. And the Public Health Service really sponsored a lot of us to really try to improve the conditions of people who are in these detention centers. So I worked there for a couple of weeks, making sure that people got the necessary medical attention that they should. And then just last year, almost a month ago, and almost a year ago, I think it was February 12th, I was called on to the Diamond Princess team. At that point, COVID was not really much of a news story. But it quickly became one, and the Diamond Princess was a focal point. And I was one of 2 CDC leads on that team and had the opportunity to go over to Japan, but elected to stay here in Atlanta and manage remotely. We did have a team over in Japan of about 8 to 10 people. Very interesting, also very nerve-wracking at times. Often I would know about the news stories 12 hours before they appeared on NBC or ABC. It was quite a fascinating experience. Unfortunately, it wasn't completely successful, although I think that was beyond our control even at the time, February of last year. So that's a little bit about me. Just one final slide about me. This is kind of my timeline. So I graduated KU Med Center in 1999, and I was active duty. So the Air Force paid my way through medical school, and I spent 14 years in the Air Force, first in training here in San Antonio, then as an infectious diseases doctor for another 5 years. And then I had the opportunity, and we'll talk a little bit about this, of working overseas. And the Navy and the Army have about 5 overseas labs. And I had the good fortune of leading a virology department in Lima, Peru, which worked throughout all of Latin America. And that was fascinating. It was really my first big introduction into tropical medicine, although I did have a chance to be introduced to tropical medicine even at KU Med Center when I did a year, or not a year abroad, but a month abroad through the international program, which really was the spark that really has ignited my whole professional career. And then for the last 7 years now, I've been at the CDC, working in Atlanta, but also with many trips over to Africa, probably at this point more than 15 or 20. Unfortunately, none over the last 12 months, though. Okay, so just a brief overview. I have about 30 slides to present, and I'm going to touch briefly on the U.S. Department of Defense and opportunities through the U.S. Department of Defense to work overseas. I'll shift then to talk about the CDC. And really one of the most common questions I get is, how can I work at the CDC? And so we can talk a little bit about pathways for those of you in the audience who are interested in perhaps ending up at the CDC one day. I'll talk a little bit about the U.S. Public Health Service, which is another avenue to work overseas. You can see that I'm in a uniform today. This is my Public Health Service uniform. And then finally, I'll do kind of a hodgepodge of other opportunities at universities and training programs. And really, most importantly, throughout all of this, I'm going to do my best to pause in between each one of these segments and give you all a chance to ask questions. Really, the 3 biggest pieces of advice, the second one is to listen, listen, listen. For those that want to have a job overseas or to work overseas. And so I think a lot of today, hopefully you can practice the listen, listen, listen. Maybe it's something I didn't do enough of when I was in your shoes, but it certainly has paid off because you don't know who will be the next person who will tell you about a great opportunity. And I'm going to try to tell you about all sorts of different ways to get your feet into global health. And maybe just one of these ways is the way that will work for you. Just to back up other pieces of advice, be nice to everyone. We usually don't have much of a problem with this in global health. It's a very nice community for the most part, but you never know who will be your next boss, who will give you the next best idea to work overseas. And so I think this is just words to live by. And then maybe a little bit more pragmatic, the last bullet point, if you speak Spanish or French, these are hot commodities if you want to work overseas. It certainly has been with the people that I've worked with over the last 10 to 12 years. Automatically your CV gets put at the top of the pile if you speak one of these two languages. And it's not really even these two languages, although when you talk about Latin America, Spanish is king, and when you talk about Africa, after English, French would be king. But Portuguese is also very important on the global health arena, Arabic, and to a lesser extent, many other languages, just depending on where you'd like to work. So let me shift a little bit just for a couple slides on the Department of Defense, where I worked for 14 years in the Air Force. And as you can see, this is a map of the world. And these stars right here are big labs that the Air Force, not the Air Force, but the Army and the Navy have overseas. And really, these are fabulous places to work. Unfortunately, you pretty much have to be an active duty person in either the Navy, the Army, and sometimes the Air Force, although there are occasionally overseas opportunities for trainees. So it's something to keep in mind. And then they're all based out of Washington, D.C. area. And so the Bethesda Silver Spring area. And you may have heard of RARE or the National Medical Research Center. So this is kind of the headquarters for all of these overseas labs. And you don't have to be active duty to work at these two sites. So something to think about if you want to go into global health. There's really no better place than the military. It's hard to go to any sort of tropical medicine or global medicine lecture without seeing somebody in uniform from usually either the Army or the Navy, although I was able to pull it off with the Air Force. And so just to hit home how important the military is to global health, many of really the landmark studies, the landmark developments have come out of the US government, the US military, including those in malaria, which is where I concentrate now. Almost every anti-malarial got its start with the US military. And this makes a lot of sense if you think about it. If you just look back at all of the conflicts that our military has been in over the last 150 years, really more troops suffer from infectious diseases than bullets or bombs. So the US government, the US military figured this out, and they've actually programmed a lot of money into studying these infectious, often called tropical medicine, tropical diseases, everything from malaria to dengue to schistosomiasis to influenza. And so there's a lot of money going into all of these. And so the military is a very good idea to go into, or at least to consider working with if you want to go into tropical medicine. And I think that's my last slide on the military. But I'm going to take a brief pause and just ask anybody in the audience if they've got any questions about the Department of Defense. Okay. Well, let's shift a little bit to the CDC. And so I know nothing's more boring than looking at an organizational chart. So sorry to subject you to this. And this one's not even up to date, as you can see. We have a new director who I think is about 3 weeks old. So Dr. Rochelle Walensky. So I had to just type her name in here. But the reason I featured this is just to give you an idea of how the CDC is structured. So the C in CDC is centers, and there's multiple centers, each of which really concentrates on some aspect of not global health, but public health. And so you can see some of them are on chronic diseases, some of them are on injury prevention, but then we have different centers looking at respiratory diseases or HIV. I'm in the Center for Global Health, which is over here. And this one's mostly based in Atlanta, except we have many people who are also based overseas in the Center of Global Health, or for Global Health. And just to drill down a little bit deeper into the Center for Global Health, that's broken up, and the CDC has its own system of centers and then divisions and then branches. So the Center for Global Health is broken up into 4 different divisions, which include the Division of Parasitic Diseases and Malaria. And so that's where I live, that's where I work. And so no more organizational charts, I promise you. Let's talk a little bit about the Epidemic Intelligence Service. And so I am pretty sure I had no idea this existed when I was at KU Med Center. However, the more that my job kind of progressed, the more I hear about EIS, so the Epidemic Intelligence Service. And so definitely something that if you have not heard of, perk up now, because it's a fascinating, a fabulous program based out of the CDC. So we call it the EIS program. And so it was famous before Contagion, but Contagion made it famous again. And Kate Winslet here actually was an EIS officer as the character in this drama. And like most EIS officers, she was responding to an outbreak. This one was a kind of a world-encompassing pandemic outbreak. And so if you haven't seen Contagion and you're curious about EIS, definitely look this up. Her character was actually modeled on Dr. Shukit, who's our deputy director. And so they hung out a lot for Kate Winslet to figure out what the role really entails. So what do EIS officers do? They pretty much do anything that has to do with public health, not just global health, but public health. And you can see that they've been present for pretty much every big outbreak that's happened throughout the world, if not the US, including some that hadn't even made this slide, including coronavirus. Pretty much every EIS officer that's with us right now either has been involved with the coronavirus outbreak or is currently at the very moment. And when I say involved, many of them end up being at the tip of the spear, the first people to show up, the people who are the first authors on the publications, the people talking to the press. They're not just taking a back seat. And these are often people in their late 20s, so very junior career people. But EIS actually allows them to have this front seat, this driver's seat position in very important public health crises. So as I said, they're on the front line. And so this is an interesting map just showing where EIS officers are stationed. And just to do some quick math here, looks like we've got about 131 EIS officers. This is over 2 years. So it's a 2-year program. So every year we accept about 65 EIS officers, and most of them actually stay in Atlanta and work for a division. We have 2 working in the malaria branch, and they work closely with me as well as a lot of my colleagues. But then a sizable proportion actually work for the states. And so they're based usually in the state capital, and they respond to any sort of public health problem in that state. For example, the Flint water outbreak. I mean, if you just go down the list of anything that you've ever heard, any food outbreak, anything along those sorts, the first people on the scene are EIS officers. And don't despair too much. I know Kansas actually will allow EIS officers. It doesn't look like they had any when the slide was presented, but I know that they show up for the recruitment, because whenever I walk by their table, I always have to stop and tell them I'm a Jayhawk. So hopefully we'll get some EIS officers in Kansas. And so who are EIS officers? They are not only doctors, they're nurses, they're EMTs, they're veterinarians, they're allied health professionals, they're those with PhDs in epidemiology. Really, any of these career fields can go in to become an EIS officer, at least as far as the MDs, the doctors. I think most, if not all, have gone through a residency, and some have gone through fellowship. So for the most part, maybe exclusively, it's not fresh out of school, but for the most part, our EIS officers are fairly young, often in their late 20s, early 30s. And then what happens after the 2 years that you work as an EIS officer? Well, many people who work as EIS officers then become CDC employees. Just a disclaimer, I was not an EIS officer. I didn't know about it, and it was probably not an option to me through my military track. But most people I work with today that are at my level were EIS officers at one point. It's very common. And it's really probably the best way to get into the CDC. When people ask me, what's the secret to get in? It's really to do EIS for 2 years, which is a fabulous training program. And then you have the secret handshake to get into the CDC. So those that don't stay at the CDC, about 85 to 90% go on still to do a career in public health. Many will stay at the states where they did their 2 years of training. So if you go, and I have a pretty good idea that probably Kansas probably has an EIS graduate or two at their public health department. Most do. And so lots of fascinating career opportunities for those that go into EIS, including overseas activities. So I think one final slide on EIS. So how do you apply? Currently you can't, just being the month of February, but it will open up again in April. And you can get onto the CDC website if you just type in CDC EIS. It will go through all the eligibility and all of the timelines, all the letters of rec and CVs and everything that you have to submit. There's also an interview process that I participate in as an interviewer, but many of us do it. It's actually a fairly competitive program, but it's very worthwhile. So something I would highly suggest that you consider doing. And I think that's all I have on EIS. But please, if there are questions, please ask them.
Yes, please feel free to unmute yourself and ask away.
Dr. Halsey, my name's Courtney Bettinger. I'm a pediatrician here at KU. Thanks so much for talking to us. I have a question. When I was finishing residency a few years ago in Colorado, I remember a fellow was applying to EIS and said that you don't have like final say over where you get assigned. Is that true?
Yeah, so that's completely true. There's a match process with it. And one thing, if he or she was applying from Colorado, there's a high likelihood that they won't match in Colorado. So that's one of the stipulations in the EIS program, that they want to put you, I think it's a 50-mile radius, maybe it's a 100-mile radius outside of where you currently are. I think that's with the exception of Atlanta. They also strive not to put you into the same discipline that you're currently working in. So for example, if we had somebody who was a master or doing a couple of years doing whatever in the malaria branch, they couldn't be an EIS officer in the malaria branch. They'd have to flip over to waterborne disease or influenza or something else. So hopefully I answered your question, but let me answer it even further. So I think it's every April we have, it's kind of like a match week. It's going to be different this year, unfortunately, because it won't be in person. But usually it happens at a hotel in Atlanta, and we have all the EIS officers who are incoming, and then we have all the programs at the CDC, and then we have all the state programs, and we all meet in the same building, the same hotel, and it's like a big rush essentially. And we'll have a table, and we'll try to sell our malaria branch to the 65 incoming EIS officers, and the Kansas Department of Public Health will try to sell their program to the same 65. And then when it's all over, there's a complicated computer algorithm that matches everybody. And it's a little mysterious how that all happens, but certainly you can't pick where you go.
Thank you. I appreciate that.
We have two more questions in the chat. The first one is from Taylor, and the question is, are certain specialties more preferred?
Yeah, so good question. So I don't know if certain specialties are preferred, but just looking through the 65 or so, every year I peruse the Facebook of everybody who gets in. And there's always overrepresented would be infectious diseases physicians. And then after that, probably pediatricians, internists, and FPs. That's on the doctor side. And just to be upfront with everybody, they do take a lot more doctors than all the other subspecialties or all the other, I guess, career tracks. But those would probably be the biggest ones. But really, they've taken all comers. The last person I supervised was an ER physician. And actually, the last person to graduate from our program in the malaria branch was a pathologist.
And then we had another question from Colette. Do most MDEIS officers have residency in internal med, fellowship in infectious disease, or other residencies?
Yep. I mean, that's essentially the same question.
Yeah.
But just to expound on that a little bit more, let's say you're not an MD. I just want to impress upon you that we do take, or the CDC takes people other than MDs. First of all, they take DOs, but they also take nurses every year. There's 3 to 4 nurses, and many scientists every year. I'd say there's probably maybe a third of the class are usually PhD epidemiologists, maybe a quarter of the class, and then just a hodgepodge of every other discipline that you could think of that's allied health. I think they've taken dentists before, certainly veterinarians every year. I know that's probably nobody on the line today, but there's, once you get onto the website, you'll see who they take and who they don't take, but it's fairly broad who they'll accept.
Thank you. And I don't see any more questions in the chat at this point.
Okay, well, let me plunge forward then. And so maybe I'll explain my uniform a little bit. So the Public Health Service. So this is one other entity I had no idea about until after I graduated from KU Med Center, probably because I didn't listen enough at that point, but I was also in the Air Force. So I was already wearing another uniform. But this is a really interesting opportunity. And again, it's not just a global health opportunity, but it's certainly one way that you can work overseas. And so the Public Health Service has been around for over a century. And you may be most familiar with the Public Health Service from the Surgeon General. You can see him here. This is Jerome Adams. And so he was a Surgeon General up until, I guess, about a month ago. So we've changed administrations, as you know, and we now have a new one. And then Brett Giroir here was also really a focal point during all of the COVID response, and actually was the Surgeon General's boss. So I think both have moved on and will be replaced. They both are not career public health service members. Most of us are. I'm kind of a funky exception because I did an inter-service transfer from the Air Force to the Public Health Service. But many people that I work with, including many people who did EIS, our public health service. And much like any other uniform wearing service, they wear a uniform to work and they have a lot of the same benefits. And I think I'll go into some of those in a future slide here. So there's 6,000 of us scattered throughout the United States, and we're one of 8 uniform services. So when you talk about the uniform services, people think of the Navy and the Army, obviously the Air Force, but also the Coast Guard and NOAA as well. So the folks that give us our weather forecasts. And so what do? We provide essential health services. Many work at the CDC, but we also work in the Bureau of Prisons, the Indian Health Service. I've been giving talks all day, so I think I'm losing my voice. Many work at the NIH as well. You can see here that this is a deployment. This is probably Liberia. Back in 2014, 2015, we actually had kind of a medical center that was stood up in Liberia for the Ebola outbreak. And so much like EIS, Public Health Service actually pulls from many different professionals' specialties, even more than EIS for that matter. So medical is the one that I'm in. It's probably also the one that they need the most people in, but also dentists, vets, nurses, pretty much any specialist that you would need to work in a hospital. So physical therapists, scientists, dietitians, you name it. And so where do we work? Throughout the US and the world. So as I said, many of my colleagues at the CDC, but we're also stationed in the DoD, One thing that I don't see here, but there are many that work at embassies overseas as well. Many times they work in embassies under the CDC. So definitely a global health component to just the day-to-day for some of us in the public health service. And then when it comes to deployments, there are many overseas deployments. Obviously, these are hard to predict, but just looking backwards, you can see that many of these deployments were international, including the tsunami in 2004. We have the other tsunamis, earthquakes in Haiti, the Ebola response. Primarily, that response was in Liberia for the public health service, although I ended up in Sierra Leone. And then obviously now with COVID, we sent people over to Japan. At this point, most of the deployments related to COVID are within the United States. And so here's just a slide of the COVID response back in February and March of 2020. And we're still deploying now, but it's just all domestic. And many of our deployments now in the public health service are from the comfort of our own basement. And so just one slide on what you get, some of the benefits of being in the public health service. It's much like the military, that there is a retirement that you can get after 20 years. There's also educational benefits for either you or your family, lots of career opportunities that you wouldn't have otherwise. So it's really a fascinating branch of service, one that's not, I think, overly publicized in a lot of arenas. But once you hear about it, I think it will really open your eyes up to maybe some possible opportunities for you. Candidates must meet basic weight and height requirements, health requirements. These are pretty much equivalent to what you'd have to get into the military. And so just one final slide on joining the public health service. Obviously, probably the easiest way to figure out this information is just to type it into Google. Or you can contact me and I'd be happy to tell you more or to link you with the appropriate people. So I think my last 7 or so slides are a hodgepodge, but I want to pause real quick and see if there's any questions on the public health service. Okay, Christine, you're not seeing anything?
Nope, nothing in the chat. I think you're good to go.
Okay, well, let's do.
Wait, one. We just had one pop up. Is basic training a requirement to join the USPHS, like it is for the National Guard or Army?
So the answer to that is no. There is training. It was 2 weeks, but it's more like training to learn the ranks, which I already knew being in the Air Force coming into it, but most people didn't. Learning the customs and the courtesies and how to fill out the paperwork. It's 2 weeks of that. So it's not anybody getting in your face, making you do 50 push-ups. In fact, when I joined the Air Force, I think my basic training was only 2 weeks as well. And it was a lot of the same stuff. They don't want to abuse us healthcare professional folks. That's not really the purpose of it. It's more to kind of get us up to speed with the language and just the community. So sorry, you will not be punished like an officer and a gentleman or Full Metal Jacket. None of that happens in the public health service.
Very good. And there is one more question. Is there a minimum time commitment?
Oh, I don't think there is, because I certainly know people who joined for their EIS, so that's 2 years, and then they got out right after that. That's uncommon. And it's such a good deal, most people don't get out. And unlike the military, the public health service doesn't tell you that you're going to be stationed someplace. You actually have to arrange where you go next. So that's a very attractive component of the public health service. Nobody's going to send you to North Dakota, but unless you want to go to North Dakota. So hopefully I answered your question on that one. And the retirement is 20 years, although there's also a better retirement if you stay for 30.
Very good. And that is all I see in the chat at this point.
Okay. well, a few more slides on just hodgepodge, other ways to get into tropical medicine, global medicine, if you will. And maybe just time for a shameless plug that this is the Halsey Infectious Disease and Tropical Medicine Training Award through the Office of International Programs. So this is actually a scholarship that is offered to a fourth-year medical student every year to work overseas for a month, either in South America or Africa. And so we fund this, my family funds this every year. And really the reason I do this is in 1998, I had the opportunity to travel over to Kenya. And actually, I didn't tell you about my first slide, but that was actually a picture of me as a fourth-year medical student in Kenya with my first tropical medicine experience, really my first overseas experience of any sort. And it really just woke me up to just an amazing new world, essentially. And so I feel like I'm forever in debt to KU Med Center in the Office of International Programs. In debt may be a poor choice of words, but we gladly fund this. And it's nice to provide this opportunity to students, because somebody actually provided this opportunity to me in 1998 when I didn't have the money to do it. So please look into this. If you're a third-year med student, know that this is just around the corner. I wasn't planning on going overseas as a fourth-year med student, but one of my friends told me about it, and I listened. And after that, I guess it's all history. I ended up in Kenya for 4 weeks, and now I'm doing this. And so you can see the last time we offered this, that Kyle got to go. And so he had a wonderful experience. He went to Peru, and we still somewhat remain in contact a little bit. And we've been doing this for 4 or 5 years now and hope to continue for as long as we can. And so shameless plug is over, but other global health training opportunities, I'm not going to go into infectious diseases fellowship, but for those that are really set on a life of doing global health and they're doctors or they're medical students right now, there's really no better way to do it than either going into pediatrics and then doing infectious diseases, or going into internal medicine and then doing infectious diseases. There's certainly 100 other ways to do it, but that definitely is the best way to do it. I mean, there's just so many opportunities, and it opens up so many doors once you're actually in the community to actually have that sort of training behind, in your back pocket, essentially. But short of that, there are many other ways to do it, including master's and doctoral programs in public health and global health. And then there's some standalone programs. So I won't talk about a lot here, kind of these middle items, but I'll talk about some standalone ways that you can immerse yourself in tropical medicine, or at least introduce yourself. And so the first is ASTMH, which is the American Society of Tropical Medicine and Hygiene. And so if you haven't heard of this group, they put out a journal, a monthly journal, but even more importantly, they have an annual conference, an annual meeting. Last year, unfortunately, was the first time we didn't meet in person, but we're hoping to do it again this year. It will be held in Washington, DC, and it really attracts global health experts from around the world. Fortunately, it's based in the United States, so the travel isn't hard on you. And it's a great way, even as a trainee, just to go and just to walk in and out of lectures. There's job posting boards, there's seminars such as the one I'm giving here about how to go into a career in global health. It's just a great 4 or 5 days. And it's kind of a low pressure way to introduce yourself to tropical medicine. Nobody's going to come up and ask you about the life cycle of malaria or anything like that. And so I'm a member of ASTMH. And so, as it says here, many attendees come to this meeting every year. I've got many global friends that I see every year. I've been doing this for 12 years. So it really has a special place in my heart. And I highly recommend going. If you even have an inkling of a wish of going into tropical medicine, there's really some fascinating speakers that come to this. Very inspiring work is being done. So 4,000 members, many of whom are international. And as it says here, many students attend this. Okay, another avenue, another opportunity is to look into doing one of these certificate courses or diploma courses in traveler's health or tropical medicine. And so there's a dozen or 2 dozen different opportunities. Some are maybe 2 weeks long, some are anywhere like up to 6 months long. Many of them have classroom components. Sometimes you'll do a classroom in the United States for a couple weeks or 4 weeks, and then they'll have an overseas experience for you. I've actually taught at 2 of these. One was taught out of Bethesda through the Uniformed Services University. And then the one that I was probably even more closely involved with was taught out of Peru. And that's the Gorgas course. And that's a very famous tropical medicine course. And it's all taught in Peru. And they've got different experiences. They have a beginner course and then an advanced course. And the beginner's course, I think, is 4 weeks long. It may be 3 weeks long. I think it's 4, where you do 2 weeks of just lectures, and that's all in Lima, Peru. And then you spend something like a week in the jungle, in Iquitos, which is a jungle city in Peru. And then you spend a week in Cusco, which is a mountainous part, which is near Machu Picchu, if you've heard of Machu Picchu, which is actually featured in the slide here. So the Gorgas course is a fascinating course. You will learn so much. You'll make so many good contacts. It's usually paid out of pocket, and I don't remember how much it costs. Although a lot of these folks get whatever university that they're working for to pay for it. So definitely something to look up. I actually have a list, I think, in my next slide of all the different courses. But before I go on to my next slide, really one of the rationales for going to this course, it's not the only rationale, is then to pass this tropical medicine test. What is this called? It's they call it the C-Trop Med examination. In full disclosure, I haven't taken this, but many people do. This is just a sample question here. And all of these courses kind of gear a lot of their lectures to answer these Trop Med questions on this board exam. And to get this, I guess it's a certificate in tropical medicine, you've got to pass the test, but you have to also work overseas for something like 2 weeks or 4 weeks. So you also check that box by doing these diploma courses. And so just a snapshot of the various courses that are accredited by ASTMH, the American Society of Trop Med and Hygiene. And this is the one that I taught, the Gorgas one. And I think the other one may be in here too. It's this one right here that I also was affiliated with. But there are many other good ones. These are just the 2 that I know of the best. Okay, I think I'm down to 2 or 3 slides. Just a word about medical missions. So this is a picture of a medical mission that I participated in 1999. So this was about a month before I graduated from KU Med Center. So I have definitely participated in medical missions. It's a very common way to get global health experience, but I have a lot of trepidation about recommending it to people. There are lots of these medical missions that are just not done in a great fashion. And so it's something that I really want you to think about when somebody offers you that chance to go with your church group or some other. These are do-gooding groups, but it often does not result in good. And some examples is that sometimes these groups will take expired medicines that are only semi-effective or not effective at all, or they'll take antibiotics, and then there's the need to give antibiotics once you're there. And all of a sudden you're practicing a different form of medicine than what you would do if you were practicing in Kansas City, Kansas. And then I at least had a lot of self-introspection about this after doing this a couple times. And this really got hit home to me. This is a JAMA article. I highly suggest that you pull it. If you're ever tempted to do a medical mission, you can just even kind of read the first sentence or paragraph here about a young man, 19 years old, who shows up in Guatemala with his torn jeans. And all of a sudden, he's supposed to be the doctor and everybody's respecting him, but he's a 19-year-old and he doesn't know anything about medicine. And you know more about medicine than he does, but even so, you'll be put in these different scenarios that maybe are not appropriate. And so it's a very hard way to do medicine. We would never allow a group from Japan to fly into Kansas City, set up on a street corner, and take care of random people. And that's essentially what we're doing when we do these medical missions. So it's just something to think about. There are certainly good medical missions. I'm not trying to denigrate all of them. I think some that do vaccines, I think that's really important work. That's usually hard to mess up. There are some surgical missions for if it's a very focused type of surgery, like a dental surgery. I know cleft palate surgeries are very popular with some groups. But I also want to feature a picture of me in 2004, and this is on the Thai-Myanmar border. And I was actually working in a hospital there for 4 to 6 weeks, but there was a medical mission that came from Belgium, and they were serving some of these immigrants on the border. And they flew in about 3 weeks before this picture was taken, and they did eye surgery on 20 different villagers, and then they flew out. And then one of these villagers, 2 weeks later, develops an eye infection, most likely infected during the surgery or because of the surgery. And now they have no post-op care, no ophthalmologist to offer any sort of advice. And I'm this random doctor working in this far-off clinic, trying to figure out how to treat an eye infection. I was an infectious diseases doctor, but really, I needed more than an ID doctor at that point. I needed a surgeon to get into the eye and to drain an abscess. So this just shows how even the best intentioned medical missions can go wrong. And it really hit home some of the toxicity, I guess, related to some of these medical missions. Again, I'm not trying to denigrate all of them, but it's not all upsides to these. So I was instructed to provide a few books that were inspiring to me. And so at least these first two are extremely inspiring books, or at least interesting books. The Coming Plague this inspired Bill Clinton. So it's kind of an old book, but it actually looks at about 14 or so outbreaks and how the response developed around them. Everything from Legionnaires to Ebola to HIV. It's really fascinating, and it can be read in different segments because each one's kind of a self-enclosed chapter. And I think it won the Pulitzer Prize. A very, very good book written by Laura Garrett. Another one was written by Tracy Kidder, and it's really a biography on Paul Farmer, who's a very inspirational figure who founded something called Partners in Health, which has worked in Haiti, Peru, and many other countries throughout the world, really bringing healthcare to really the most underserved people in the world. And so Tracy Kidder is a fabulous writer, and he followed this fabulous public health practitioner throughout the world, kind of documenting his good deeds. It's a very inspiring book. Maybe also a Pulitzer Prize winner. And then probably less inspiring, but also very interesting, is just a history of the biowarfare program out of Russia or out of the former Soviet Union. If you ever want to be scared by a nonfiction book, this is really quite interesting. And so this was Ken Alibak actually defected from the Soviet Union and was debriefed by the CIA. And these are a lot of the stories he has to tell. And then just a few other infectious diseases books that I have to plug. In the Band Played On, probably the best documentary, both as a novel, but also as a TV series of the HIV epidemic in the United States. The Hot Zone, also a true story of an Ebola almost outbreak that happened in Virginia. And then complete fiction, but a book that I read when I was in junior high and now I'm reading again, written by Stephen King, The Stand, about a plague that wiped out most of the earth. Very fascinating, very long, but considered by many to be Stephen King's best novel. So that's all I have. It looks like we have at least 5 minutes if there's any more questions about anything that I touched on.
Yes, please feel free to unmute yourself. Ask away. That was fantastic. Thank you so very, very much.
And this is a picture of me in the Amazon. And we were doing house visits. We were following people who were infected with a certain mosquito-borne virus called Myaro virus. It's somewhat related to dengue or chikungunya or Zika. And what we were doing is after these people were infected and diagnosed with Myaro, we wanted to see if they were still sick a month, 2 months, 6 months afterwards. So they weren't coming to us at that point because they weren't sick anymore, or at least sick enough to come to us. So we actually had to find them throughout the Amazon and ask them a set of questions to see if they still were sick from their initial mosquito-borne virus.
Dr. Halsey, you may be starting on kind of what you just shared might be from this, but I'd be curious to hear more about what you did while you were in Peru for a few years.
Yeah, I gave that really a short shrift in all of this. And I worked there for 4.5 years, and I ran a virology department, and it was a 100-person department, and of which about 5 people were active duty US citizens, and then 90 to 95 Peruvians. And I essentially ran the Navy's dengue surveillance program and dengue vaccine program. So dengue, as probably many of you know, is a tropical disease. It's very debilitating. It's found predominantly in South America and Asia, and it's very important to the military. And so I became a dengue expert over 4 years. It's a great thing about working in the military, not just in the medical profession, but many professions, is they take very young people like I was at the time and say, you're going to be the expert at this. And you become the expert because the world's leaders come to you when you're stationed overseas because they know that you've got the access and the laboratories that they need. So I really did a lot of arbovirus work, so mosquito-borne virus work, as well as respiratory virus work, and got to learn how to run a laboratory, which is something I never knew how to do as a clinician, and learned Spanish and had a wonderful time. I was based out of Lima, but did most of my work in Iquitos. And this picture here is taken probably 20 miles outside of Iquitos, which is the world's biggest city that does not have road access. You can only boat in or fly in, 500,000 people.
Thank you.
Are there any other questions or comments? Please feel free to unmute yourself.
Well, I do want to encourage people to reach out to me. I touched on a lot of various avenues and just kind of hit the surface of all of them. So feel free to reach out to Kimberly or Christine. I'm happy to talk with you either over email or over phone if you want to get more information about any of these.
Dr. Halsey, we really appreciate your time and generosity in sharing your knowledge. We will share this recording out, so you may get some individuals reaching out to get more information from you. I'm really interested personally, and we can talk offline, but I have a son who is a combat medic in the Army National Guard. So he's currently really busy with COVID. First it was testing, and now it's giving immunizations. And he's really interested in continuing like down this path, but I'm not sure really how to direct him in terms of, what are his options? Because he really enjoys the medic and the work that he's doing. So I'd love to hear from you, like what his next steps might be, in terms of continuing and having a career. Maybe not as a doctor, but maybe there's something else. I just like to know all his options.
Well, Kimberly, so I think we should talk offline, but I'll share at least one option with you right now because I think it's an option for anybody in this audience,
Right.
regardless if they're a medical student or a nursing student or neither, is just doing a master's in global health. Okay. or public health in general. I mean, that's such a great avenue. And afterwards, you can go on to get a doctorate. You can go on to medical school. You can go on and just practice as a global health specialist and work at the CDC or at a local public health institution. So that's something to think about. I think being in the military gives him a leg up on a lot of people because that is respected.
Mm-hmm. Right. And there's also financial support for his education, which is really nice.
For sure.
That's a really. I would like to put a plug in for InMed while you talk about the Masters in Public Health. InMed is a local organization. Dr. Kamana Nellis has been involved in global health, for 20, 30 years. and they are offering now a master's in global health. So we can share that link. Excuse me, we can share that link, or people can contact us for more information. One of our doctors, Dr. Kovac, who's an anesthesiologist, who also does education in Peru and Ghana. He goes to exchange with residents. He's actually just starting this master's degree program at InMed this semester. So it's pretty cool. He's really interested. He's at the end of his career as an anesthesiologist and just now really getting excited about the global health. So it's kind of cool.
Yeah, those master's programs are open to, I think, anybody with a college degree.
Yep, fantastic. Well, thank you so very much. It's been wonderful. You're a great presenter. Always enjoy talking to you, Dr. Halsey.
Let's talk offline if you've got more questions, and thank you for allowing me to do this today.
Thank you very much.
Appreciate you. Thanks, everyone.
Thank you. Dr. Halsey, I'll also encourage you to look in the chat box. There are several nice comments in there.
Oh, great. Okay. Well, thank you.
Thank you.
Yes, please connect me with anybody that needs to be connected.
Yes, we will. Absolutely. Okay. Thank you very much.
Okay, great.
Thank you, Mindy.